welcome. Just checking that I'm audible everywhere. Perfecto. Bienvenidos.
So everybody welcome. I'm going to speak in English, but before I switch to English, I hope everybody has the headsets that you need for the interpretation services. I'm not entirely sure about the channels, but I'm sure you'll find the right channel for the right language. And it's a great pleasure for me to be here, particularly on this hybrid event. It is also a great pleasure to greet everybody online, but especially also the very few but very exclusive ones that are here on the 47th floor of the Torre Emperador with these wonderful views. Someone told me that there was British weather, but it's not true, because in the UK it's really sunny these days. It might be something relevant topic for what we're going to discuss today. I don't know. So it's a great pleasure, of course, to have Pilar Aparicio with us, the general manager with us. We've talked so much these previous years on the so complex management of the pandemic. They're still with us. We have to remember that, but fortunately it's getting better. So thank you very much for coming, and thank you very much for your collaboration and your support on this initiative.
And a special mention as well to all the partners who've worked with our team here in the embassy so closely to make this a success. Ecoles, for el Consejo General de Colegios Oficiales de Médicos, and to GSK. I'm looking for Christina here. It's very nice to see you as well. Because as well as being the principal partner for the pharmaceutical sector in the climate change conference for the sector, I know you're a brilliant example of what, as I've been able to see myself when visiting your sites, for all that you're doing to lead the way on sustainability. So it's great. Thank you very much for making the time, particularly after such a very, very long day. I think Christina's day started quite a long time before most of ours. Before I start, I wanted to sort of pause a moment, because we're all living this slightly dual existence at the moment, where on the one hand we're seeing the headlines of this terrible war in Ukraine, on the other we're getting on with all the things that we have to get on with. So I just wanted to say, Ukraine is so present in our minds in so many different ways. We have, I think we've discovered, certainly in our own network, we have discovered our own I didn't know that we had Ukrainian staff in our team in Spain, and we do have Ukrainian staff. We have lots and lots of connections we found with Ukraine just among our own network. I've come right now from just a little mini ceremony that we have had with children from the embassy, planting sunflowers in our residence garden as something which will have, very much the symbol of Ukraine growing, we hope, if the seeds grow. I very much hope they do, over the coming months, and planted by one of the children who was born in Ukraine, and is now 3 here. I think one of the things that it's showing to us is just how extraordinarily interconnected the world is, in ways that we sort of take for granted. And that couldn't be more relevant, I think, to climate change, because it is one of the biggest and most totally interconnected challenges of our time. And you all know all of this and all the background, so I'm not going to make a long speech about climate change. But it is worth just recalling that at COP26, we did make really good progress, agreeing the Glasgow Climate Pact and getting consensus on the need for urgent action. And so collectively, we've managed to narrow the ambition gap, because we've got net zero commitments covering 90% of the world's economy, which is, that's a big deal, because that is up from 30% only 2 years ago. And that's something we're having a slightly longer preparation for our COP summit than we expected, 2 years instead of 1. But we tried to use that time working incredibly closely with colleagues in Spain as part of that, to increase that ambition and to get those commitments through the door. And so the Climate Pact means we've got 1.5% still in sight, but it needs a huge and sustained and committed effort. We all know the risks that we've got. We all know the marginal impact of even just 1/10 of a degree extra, the risks of the positive or the negative feedback loops kicking in. And so, we really have a great deal to do to make that target, and that's a lot of very specific and hard work. And with that in mind, what we're doing today is bringing together key players in the health sectors in the UK and Spain. I think it's great that we've got this bilateral partnership. At COP26, as I said, we work really closely together, and we and the 48 other countries across the world committed to the health programme, which is a series of initiatives focusing on health sector leadership on climate change and building a focus on resilient and sustainable health systems, which is what we're going to be hearing about today, and raising the voices of healthcare professionals who are advocating for stronger and more ambitious climate action. And we've pledged to keep our health systems, to help our healthcare systems lead the world in reaching net zero. And that's really important because globally, some 4.6% of all emissions are generated within the healthcare sector. And the NHS alone represents about 4% of the UK's total carbon footprint, which is just huge. It's absolutely extraordinary. And we'll hear about the work that's underway for that. It's really exciting. I've been learning about it myself. I've been incredibly interested. I was in the Canary Islands only recently learning about the fantastic work that's going on there with the regional government. And we'll hear, I could say more about what the NHS is doing, but I rather suspect we're going to hear more about that in a second. So I won't dwell on it. I also know that, as well as in the Canary Islands more broadly, there's a lot going on here in Spain. Obviously, you've got, like we have, the challenge of adapting to the changing temperatures, and I'm pleased that ahead of COP26, Spain agreed to co-lead with Fiji the Adaptation Action Coalition's health work stream, and so we really look forward to Spain continuing to share best practice in that forum too over the coming year. And given just how big and complicated this challenge is, I really hope that today will just be the first of a series of collaborations, and from what I hear from Shona, from the conversations you've had today with this visit, I mean, we just see tremendous opportunity to learn from each other and to work together to tackle this problem. The lema, what's that in English, of COP26 was from ambition to action. And I've given a lot of talks over the last year or so about climate change and the importance from ambition to action. But then when I finished the talks and I've walked off and sort of seen a mirror, I felt distinctly uncomfortable, because within our own little world of the British Embassy and our 8 consulates here in Spain, we haven't had our own plan. We've now launched our own plan to get ourselves to net zero. We haven't got a date yet because we're still in the process of working out what the sheer scope of the challenge is. But we have that commitment. We will get a date. We are beginning to do some of the things which many of you have been doing for some time. So we're particularly interested in learning from you so that we can apply it to what we're doing in our little world in the embassy. And we'll be telling that story. We're behind the game. We're not where we need to be, and we recognize that, and we want to catch up. We want to catch up quickly, and that's from learning from you. So congratulations on what you're doing. Huge job ahead, and thank you for all the collaboration. And I now would like to pass over to Victor Vinuelas, Executive Director of Ecoles, who will coordinate, I think, the first part of the event. Do we need the first panel? There we are.
No. Sí, Nick y Pilar, sí. Sí. Aquí parece que nos han puesto. Sí.
Nice to meet you.
Bueno, así. Toma ahí.
Gracias.
Mi segundo apellido es.
My second surname is Edo, which is the old capital of Japan. And in Japan, they have a word that means itarakimasu. When they sit at the table to thank all those people who have made that dish possible to get to the table, the farmers, the fishermen, the logistic companies, the cook, the chefs, etc. So the first thing I wanted to say is itadakimasu, and thank the British Embassy for doing something that ultimately is very well connected, isn't it, Pilar, with that novel, one of the first novels, the Celestina. The mission of the Celestina was to connect lovers with each other. And this task, the task of connecting networks, connecting friends, cooperate, is absolutely crucial for the 21st century. So thank you very much for organizing this event, which, from my point of view, has as a goal the promotion, the enhancement of cooperations, the connections between the UK health system and our country's health system. So thank you very much for that. Thank you also to the British government for promoting, together with the World Health Organization and the UN Convention, this health compact for climate from the COP26. Often the media hasn't reflected very well the outcome of the COP, and they only talk about one part of the COP, which is the official COP. The COP, the consensus, where 197 parties, which are many, have to reach an agreement anonymously, and they have forgotten the other COP, the COP of the pioneers, the COP of the voluntary agreements, where without any obligation, those parties, whether they're governments, regions, companies, etc., they say, we're going to do this, let's do this, we are ahead of the consensus. That is the compact for the health system climate action. So thank you very much for promoting it, and thank you very much to the Kingdom of Spain and the United Kingdom for signing it. Only 3 European companies launched it. That was Belgium, the UK, and Spain. And I think that precisely one of the goals that should, or for which this meeting could be useful, is to promote, to push the implementation. The ambassador mentioned it. It's about it's good to have commitments. Having intentions is good. Making plans is good. But making things happen, which is what changes the world, is even better. So in that sense, I think we are lucky, we're enormously lucky to have with us two very special experts. Pilar Aparicio, who is the General Director for Public Health of the Ministry of Health in Spain, and Dr. Nick Watts, Chief Sustainability Officer for the UK NHS. And before I give you the floor, I wanted to thank you for what you've done in the two health systems, and you continue to do throughout complicated times. I know you're going to say that you haven't done it on your own. It's a whole ecosystem working on it. But I think as a society, we have a saying in Spanish. It's a bit old. It's not very used. It says, "It's good people are good at saying thank you." And I think generally in the planet, and of course I'm sure in the UK and definitely in Spain, we are really thankful to those who within the system, with an enormous health tension and stress, with scarcity of resources and etc. You've handled all these. I mean, I'm sure you've heard this many times. I want to say it once more. Thank you very much to you and to those present here today that manage the health system. Thank you very much. And without further ado, I'd like to start. Who wants to start? The UK? The Kingdom of Spain? Okay, if you want, I'm happy to. Well, thank you very much, Victor. And perhaps I start by thanking on behalf not just the Ministry of Health and all the team at the Ministry of Health, but also on behalf of all the health professionals that have contributed to making things a little bit easier. I'm talking about this terrible health emergency that we've gone through and we're actually still going through. we always like to hear, and hearing it again is good, and everybody has dedicated a big effort. I also want to thank the British Embassy for organizing today's event. For us, is very good. We're here mainly to learn. Thank you for giving me the floor, but the truth is that we're here to learn a lot from the British system, because we think that you've made a lot of progress with regards to the sustainability of the system. We'd also like to have a head of sustainability with our national health system, and we're going to work on that so that we can follow the steps that you've taken. We've done it many times, and we do it once again, not just within our scheme, our primary care, and the whole system. Basically, we'd like to thank the effort in the UK. I'd also like to thank the words of the British Embassy. We've always been very well connected to each other in the last 2 years. There's been a connection with the whole team. With me, definitely, but with Fernando Simon, I think you've ended up being very close friends, have you? So I think there's been a very good communication with regards to the management of the pandemic. And I'd also like to remember the words mentioned by the ambassador. We're talking about the footprint, but we're also seeing the enormous disaster for an enormous, for a great nation, for a great population. Also, it's having an impact on the climate change, of course, but we're all pretty impacted that we are seeing what we're seeing in the actual 21st century, and we're really concerned about what's happening very close to us, but it also has a very immediate impact on the lives of so many people. This has been a very cruel war. It's been very harsh, and we are all seeing it developing these days. So for us, as I was saying, this session is fundamental, and we'd like to thank you for getting together different stakeholders. Like Victor very well said, we want to make a reality of all the topics that are discussed in big meetings. We were lucky to take part in the COP25, even though it was kind of like a bit unexpected. But for us, it was a very interesting experience, because we managed to discuss a lot of health issues, of the health agenda, because we know about the impact of climate change on the health of individuals, and we know that that is a factor that helps the people to take action, to help, contributes to raising awareness, etc. And we all have to be careful, or we all have to take care of the health of our planet, because it's our home. And you very well said, Victor, how important it was in the COP26 to sign this agreement. For us, we are really thankful for the UK initiative to take this program to Glasgow. I think we came with the idea. I also like to thank the team, the deputy manager of the environmental team, Mrs. Caballo, is also here with us. We wanted to show a little bit how we see the whole situation. The ambassador has pointed out that there are experiences that are very good, and they're going to be pioneers, and they're going to be very useful. We're talking about all the effort implemented in the Canary Islands, and that road towards the sustainability of the national health system, and also hospitals that are joining their own initiative. They're joining the goal, the project, and I think that is quite key in the Spanish national system. They always tell us that all the competences are transferred locally, but from the Ministry of Health, what we always try to do is we want to use all those good practices. The avant-garde position of many Spanish regions there is a reason why Conrado is with us today to tell us about their case in the Canary Islands. All those best practices help us to move forward in the system as a whole, in the national system as a whole. So I think everybody knows the moment that we're going through, and we already observe the impact of climate change on health. In the past, we've seen it, and we continue to see how it changes. Well, we're really pleased with the rain, but it is true that when you talk to other friends who are now in France, in Paris, in London, or in Geneva, or Berlin, they tell us how these days they are enjoying very sunny days, and it's true that we have this rain that we so much want. But it is true that we have gone through extreme temperatures with heat waves that have had an impact in the number of deaths and casualties, which are grown. We're seeing this in other countries. We see how the the weather events are multiplied, how the air pollution is getting worse, the water pollution is getting worse, etc., etc., accumulation of waste. And all this has a common impact, which is an impact on the health of the individuals, but at the same time, there is a cause, and the cause of it all is human activity. And in that sense, we are obliged to fight it. We've also seen a lot of work being done on the effects of greenhouse gases. You've already mentioned it. The contribution of the health system, the health sector is big, and to think that we represent 10% of those carbon emissions is a very high figure, and we should all be concerned about it. And at the same time, because we are the health industry, the health sector, we are concerned about the health of our population, which means we also have to bear all that in mind. For us, in that sense, we think that that is why it's so important for all the public health policies to tackle this issue. And that is why we need to know about it. We need to know, first of all, that what our contribution is, how it is reflected, how it is studied. And here we'd like to know the experience from different points of views in your countries, international experiences, etc. The idea is to know how can we get to know all that carbon emissions from our health system, so that we are aware of the fact that this has an impact on the population. This is a serious impact, and we have to be ready, we have to get ready in order to take part on the mitigation in a more active manner. That's why I also mentioned the importance of the Glasgow COP26 with the health agreement, like Victor mentioned. It's not been recognized properly. I think there are still very few countries, but I'm sure other countries will join along the way, and that will be very helpful for us to move forward. From the Ministry of Health and in collaboration with the Ministry of Ecological Transition, we have been working together for quite some time with all the different sectors, the autonomous communities, all the scientific sectors, and the civil society, the different society organizations. The idea is to have a strategic plan on health and environment that addresses all the components that are going to have an impact from the environment on the human health. And the idea is to get ready to not just detect those problems, but also to have the right tools to face it.
This plan is very ambitious for all, and it covers several and various areas, but certainly integrating carbon footprint and emissions into this plan in connection with the health system is something we really need to bear in mind as a priority. We are working along those lines with the with the Ministry for Green Transition in certain specific jurisdictions and hospitals, and there are several initiatives out there to understand, measure, and quantify the type of emissions caused by health centers, both newly constructed centers and traditional buildings, as well as the emissions caused by first aid attention. We also need to understand the limits we need to set for each center, and in that sense, we need to gather consumption or utility consumption data to measure direct and indirect emissions in connection with the use of power or other resources. In that sense, within Scope 1, we know that we need to count the use of heating, air conditioning, fuel, all the fluorides used in AC, the use of car fuels, electricity, and then under Scope 3, other emissions coming from other products and byproducts. And that's one of the targets of the entire national health system, to take note of these global interventions and acknowledge the contribution of health systems to climate change, and to reduce the emissions of the health sector in its supply chain. I wouldn't want to finish my speech without mentioning the different initiatives launched by green hospitals and healthy hospitals that we have heard so much about, or the Association of Doctors and the Medical Alliance Against Climate Change. I believe that the system has to move from within, so that professionals can adopt the measures that will make us all more aware of the required changes. So I'm leaving my presentation at a very superficial level in order to hear the experiences and initiatives from the UK, so that we can learn from you to apply these solutions to our systems as well. Thank you. And thank you, Pilar. That's no easy task. Coming up with a plan to deal with climate change when we're actually struggling a tiny but very evil virus is not easy. It's difficult to find the time to deal with the matters that are important and leave aside, or without leaving aside, the urgent ones. So, since Pilar has mentioned much of what you're doing, I think you're up.
Fantastic. I'm going to take this off if that's okay. Ooh, and I might take all of this off as well. You can hear me?
Perfectly. Healthy. We are very healthy now.
I was last in Madrid at the end of 2019. November, December 2019 was the last time I was here. I was here for COP25, for the UN Climate Change Conference, for 2 weeks. I said something a little bit silly when I was in Madrid last time in 2019. I said, wouldn't it be great if we could get a healthcare system to take on the challenge of climate change, to commit to going to net zero? Everyone said, that's crazy. It could never happen. 2.5 years later, a pandemic later, the United Kingdom, Spain, 14 other healthcare systems have now made that commitment. It is ambitious, it is positive, it is possible. I promise you it is inevitable. It is so exciting. I'm going to talk about 3 things. I'm going to talk about why the NHS, why a healthcare system should respond to climate change. I'm going to talk about how, what we should do to respond. And I'm going to talk about some of the practical steps, not things in 2045, not things in 2050, things in 2022. Because the time for talking about action a decade away, that was 2 decades ago. Number 1, why? I'm a doctor. The NHS exists. It has existed for 70 years to do one thing: deliver high-quality care for all of our patients now and for future generations. Every single hospital in the entire country, it's written on the front door as you walk in: high-quality care for all, now and for future generations. We know, because of the science you just showed us, you cannot do that. It is not possible to live up to the promise of the NHS unless you tackle climate change. We know that because in the United Kingdom, we are expecting a doubling of the number of NHS hospitals on high-risk floodplains. We are expecting a tripling of the number of fatal heat waves affecting hearts, kidneys, brains. Not in 2050, not in 2040, 8 years from now, in 2030, you cannot deliver a high-quality healthcare system unless you tackle climate change. It is not possible. The other reason we care, the other reason we should engage with this is because our staff love it. The NHS, we employ 1.4 million healthcare professionals across the country. Every year, we go out to them and we ask them, hey, what do you care about? What do you want to see the NHS do more of? Every single year, 9 out of 10 doctors, nurses, therapists shout back, I want to see the NHS take on climate change. I want to work for an organization that lives up to my values. I pledged an oath. First, do no harm. In 2021, in the middle of a pandemic, we asked that question again, and I was a little bit worried because we could be forgiven if the healthcare profession of the United Kingdom, of Spain, across the world was doing other things. 91% responded positively. In 2022, 92%. The numbers went up as we went through the pandemic because the health profession started to understand the fragility of a healthcare system, started to get a real sense of what happens when a healthcare system gets overwhelmed. And that is what we are talking about when we are talking about climate change, when we are talking about heat, flood, the spread of Aedes aegypti through Egypt carrying dengue fever, carrying chikungunya. That is what we are talking about. That is why. The what, if this is a climate crisis, very simple, net zero. Net zero for our total global footprint, scopes 1, scopes 2, scopes 3 by 2045. Nothing else is good enough. Nothing else is ambitious enough. If the climate crisis is a health crisis, act like it. That's why. That's what. But let's talk about how, about what that looks like in 2022. For the NHS, it looks like investing £500 million, £500 million into decarbonising hospitals across the country. We can do that because we know that it will pay for itself in 3.5 years. We know that it is a good investment into our hospitals, into our staff, into our patients. It looks like taking some of the standards you were talking about, Pilar, applying new net zero hospital standards to all new buildings over £15 million in the NHS, all retrofits, all new buildings built to a new net zero standard, because anything less than that is not good enough for our patients anymore. It looks like innovation, and we've invested £24 million into innovation with our friends at the Medical Research Council, the National Institute of Health Research, new net zero healthcare competitions, coming up with new technologies, looking at ways to birth the world's first baby born with zero emission, net zero anesthetic gas, as James did in Newcastle Hospital. The world's first zero emission ambulance, fully electric, carrying patients right now in Birmingham. Our patients love it. It is quiet, it is comfortable, it's so much better to be in than an ambulance with a diesel engine with the air pollution out the back. It looks like a new partnership with our suppliers. We have to be honest, the NHS cannot do this alone. No healthcare system can do this alone. And so with GSK, with AstraZeneca, with healthcare suppliers around the world, we've been very clear. Within the decade, April 1st, 2027, the NHS will no longer purchase from anyone that does not meet or exceed our commitments on net zero. We only want to do business. We are good healthcare professionals. We only want to do business with companies that are living up to our values, that are heading in the same direction as us. The response from the 15 largest suppliers of the NHS, GSK was one of them with Emma, was absolutely, we are with you. We look forward to this. It is going to be a tricky journey, but we know that if we go on this together, we have a good crack. So it looks like investment, it looks like innovation, it looks like investing in clinical leadership. We have new clinical fellowship programs for our best doctors, for our best nurses, for our best healthcare managers, giving them opportunities to travel around the world and learn how sustainability works, not just in the NHS, but everywhere. And finally, it looks like new partnerships, not only with our suppliers, but with healthcare systems. In 2019, there were no healthcare systems anywhere in the world that had a net zero commitment. October 1st, 2020, the NHS made its commitment. Half a heartbeat later, 15 other healthcare systems. I think Spain was number 2. It is so impressive in the middle of a health crisis like COVID-19 to see the Spanish healthcare system respond to the climate crisis as well. We were so excited because we know that the NHS cannot do this alone. And so, in Glasgow, only 6 months ago, we announced a new partnership with the World Health Organization to take those commitments forward, because commitments are fine, but action, year after year, is what we need now. And so, with the WHO, we are looking for friends. We are looking for healthcare systems who have a strategy, who have a plan, who are going to implement it, who are going to hire a chief sustainability officer, I am sure, to take this forward so that we can collaborate, so that we can purchase some of those ambulances together, we can share our procurement practices, we can share best learning in Spain, in Germany, the United Kingdom, the United States, all across the world. When we all move together, that is when climate action for a healthier population, that is when it doesn't just become possible, it's not just positive, that is when it becomes inevitable. Thank you.
Muchísimas gracias, Nick.
And thank you, Nick. I believe we're all deeply convinced that the climate, the health, and the global challenges ahead of us require much enthusiasm, goodwill, determination, and courage. And I believe all of those are highly influenced by hope. And your speech was one of strong will and hope. We need you to come more often, to do some more preaching. We will be calling upon you, okay? So now that we have all spoken our minds, I would like to open a Q&A period to foster participation. And I'm opening fire. From my personal perspective, the World Health System should do 3 things at the same time, regardless the country. First, reduce emissions, therefore mitigation. 2, as you said, adaptation, how the health system is preparing to face heat waves in Europe. Only in Italy, there were temperatures of 48.4 degrees Celsius were recorded. But in Spain, we came close to those temperatures. So how do we tackle these issues that will have to be dealt with by the health systems? And 3, and I haven't heard many people in the health system say this, but in my view, the health system has to act as a huge community of influencers. And that influential capability should be used to promote healthier lifestyles for individuals and for the planet. So from those 3 perspectives, how do you think your respective countries' health systems stand? Are you prepared to tackle those areas? What's your balance? Should I start? Well, I would say that's a very good question because you're forcing us to land very specific aspects. About mitigation first. Well, I believe that this very meeting we're holding today can be of assistance to start walking that path, but the work done by some communities in the Canary Islands and others that have been mentioned today can be seen as a role model for those of us who are working with the Ministry for the Ecological Transition to truly ascertain the emissions in our health centers and then move on to apply the measures required for net zero. We need to read the indicators. We need to understand how our professionals feel about about their own contribution to mitigating climate change. And I think that's a good starting point because our professionals play a fundamental role. So that's for mitigation, about how our systems are adapting to these new heat waves and changes in our climate. Well, one of our top priorities is preparing, and I think we learned a lesson from COVID-19. We learned that we need response plans to actually respond to any health emergency that comes our way. Not just health emergencies, but also climate emergencies, with heat waves as a clear example of it. Perhaps because we regularly go through these heat waves and have done so for a long time in history, with a long-living population that continues to age more and more every year, we have a certain amount of expertise on the matter. Since 2003, we've been working on gathering data and on preparing emergency plans every year to face extreme temperatures. So we've already conducted several analyses, preparing for a national alert system that is always implemented since June 1st to September 1st. We try to stay on top of weather forecasts and to prepare geographically by regions to understand weather forecasts, to adapt our response capabilities, and to warn the population, to issue general recommendations on what to do, what not to do, and how to protect themselves against a heat wave. And we also prepare our own health system to respond to, well, in this very specific case, extreme temperatures. We have perhaps our position against cold waves is not as strong. We just, or last year, we went through an unexpected cold wave called a Filomena storm, which had a huge impact. Well, most of the impact was that in Madrid, everybody went out on the streets because they hadn't seen snow in a while, and we had 2,000 broken limbs in our hospitals in one single day. Because everybody wanted to enjoy the snow, but nobody was prepared for it. And, well, people took out their skis to ski on the streets of Madrid. And, well, there were other emergencies in hospitals, and we had many people helping out, transporting patients from one place to the other. People who drove 4x4 vehicles actually assisted the national health system in transporting patients during and after the storm. But in recent days, we've also had some extraordinary weather events. The sand dust coming from the Sahara Desert reaching Spain, and with serious effects on the health of the population, which have massively moved towards the health system for assistance. So we need a highly resilient system to respond to those emergencies that seem to be more and more frequent every year. So we need to be prepared to respond to these effects of climate change. And about being influencers, well, certainly we will soon have the opportunity to better understand this new alliance, Doctors Against Climate Change. Actually, one of their objectives is something you mentioned, Victor, acting as influencers, informing and the population and raising awareness about these matters. And for us at the ministry, in our strategy, in our national health system strategy for prevention, seeking intervention at several levels, we are working at a local level with the Federation of Municipalities and Provinces in our country to generate those healthy environments to give citizens greater visibility on the subject. We also work with the Ministry of Education so that school material includes education for health and for countering the effects of climate change, to make our little students knowledgeable on ecology and climate change. And I believe that's one of the ways we can change the future, isn't it? I remember when I was growing up, smoking was no big deal, whereas our children are now telling us to stop smoking. I remember those times when we used to drive without a seatbelt, and then, thanks to the context they were getting at school, our own children were telling us to buckle up or telling us to close the tap if there's a tiny droplet of a leak. And obviously, the third environment to help our population learn is the health system itself. And I believe our health systems are very similar. Not only our hospitals, but also our first attendance systems play a fundamental role in educating the population in favor of preventive action and health prevention. Nick? What about those three tasks in your system? Mitigation, adaptation, and influencing the population into a healthier lifestyle. How do you stand along those three fronts?
Maybe let me talk very briefly about the first two. And the answer is simple. They are the same thing. You must never do anything that mitigates, that reduces emissions, that worsens your resilience. You must never do anything that improves your resilience, that also increases emissions. You must always tackle mitigation and adaptation together, and baked into the very DNA of our net zero strategy, of everything we do, is making sure that we are always simultaneously thinking about reducing emissions and increasing resilience of the healthcare system, always. But the third thing, that is the most interesting part for me. Yes, the NHS, healthcare systems around the world are 5–6% of emissions, but we are powerful leaders. Nurses in the United Kingdom are by far the most trusted voice. Doctors are third, I think. Nurses, if you want to trust someone, you go and find a nurse. We have a role then in advocating for a healthier future, not just within the healthcare system, but across the entirety of the economy. And there's two things that are coming up in just a second in the United Kingdom that I'm really excited about. Both of them in our new national healthcare bill moving through Parliament right now. It will be approved in 2 or 3 months, maybe 4. It is going to have two crucial changes. Number one, it is going to say that the purpose of the NHS is to deliver high-quality care for all, now and for future generations. Yes, it has always said that. But it is also going to say that the purpose of the NHS in national legislation is to get to net zero, is to tackle climate change, is to protect the public from that. And building it right into the heart of our national legislation, I think, is critical. But the other thing that the bill will do is it will give the NHS the ability to start to engage in a much broader conversation, to start to invest out into local communities, to leave the four walls of a hospital and invest in efforts to reduce air pollution, efforts to make our cities more livable, efforts to improve diets and improve physical activity, taking on that much broader role of the public health doctor, of the healthcare professional, as the advocate for the entire public, not just for the person and the individual in front of you. Those two things, I think, are critical to this transition, and without it, none of this matters.
Muchísimas gracias. El mandato que la organización da al moderador es que cumpla el tiempo, ¿eh? Entonces nos quedan un minuto y algo. Y yo quería haceros una petición a ambos dos, pero también a la embajada. A la embajada a que siga haciendo esta labor de celestinaje, ¿eh? Y al gobierno de España y al gobierno del Reino Unido a que en la próxima COP, que es la de Egipto, y que además el Reino Unido está responsabilizado hasta esa COP, ¿no? De alguna forma pensemos entre todos y sobre todo vosotros cómo acelerar ese compromiso de Glasgow, ¿no? Para incorporar a más países e incorporar a más acción. Esa sería mi petición. Y ahora pediría varios aplausos, uno para los magníficos ponentes. Otro para los organizadores, la Embajada Británica. Otro para la gente del sistema de salud en España, que no es, y lo sabe Pilar, un ecosistema muchas veces propicio para la innovación, y que sin embargo están en punta de lanza cambiando cosas y haciendo cosas, ¿eh? Y otro para la gente que estas cosas sean posibles, como la gente de sonido y la gente de la traducción. Muchísimas gracias, ¿eh? Pues vamos a sentarnos. Bueno, ahora me parece que está la otra.
Now I believe that our moderator for the next round table, Manuela. You sit in the middle. Manages all from there.
It seems like we're a little bit delayed, so let's see if we go straight to the point. And I'd like to start by thanking the British Embassy for their invitation to the General Council of Official Colleges of Physicians. I think we're here to learn, and we have a lot to learn. But the truth is that we are aligned with the commitment of climate change. Well, the commitment to fight climate change, and in that sense, we are really thankful to the invitation, to the embassy for the invitation. We'd like to thank the previous speakers who have laid the situation very nicely. But in this roundtable, what we want to do is we want to learn. We want to learn from good practices. We want to learn strategies. We are all convinced that it is true that we have to fight against climate change. But in many occasions, what we lack is what is it that we need to implement, or what tools, or how to do it, or a bit of a push in order to start with some kind of project or some kind of protocol. And this is going to be present today. Here, that's why we have with us very incredible experts as speakers. And I'm going to give you I'm going to read the CV of all of them because it'll take me an hour. But James Dixon will be our first speaker. He is Associate Director of Sustainability in the NHS, and James is an ecologist with over 20 years of experience. And he worked on the implementation of the environmental management in Newcastle, and it was awarded as the most ecological city for 2 years. He's also a person that is very knowledgeable of the health sector, and he's working on the health sector as well. So he's going to tell us about the commitment. It was the first health organization to declare the climate emergency, but also the first one to commit to accelerating the decarbonization of the services, like we've seen before. Next to me, I have Mr. Conrado Dominguez. He is Director of the Canary Islands Health Service. He has a degree in financial sciences and businesses. He has a master's on health economy and drugs, and he has a postgraduate in health economy by the Pompeu Fabra University. Conrado has worked in the health sector and in educational sector, and he is going to explain mainly the zero health emissions project. Dr. Carlos Cabrera cannot be directly with us, but he's going to do it online. Hello, Carlos. Well, Carlos is part of what has been already mentioned here today, the Medical Alliance Against Climate Change. He's a pneumologist on the Negrin Hospital in Gran Canaria, in Las Palmas de Gran Canaria. He works on the pneumology department of the hospital, and he works on the monographic consultation of DCPO and asthma. He has shared his enthusiasm with us. Him and his father, actually, the Medical Alliances Against Climate Change, they are actually the promoters of this alliance within the council with the Council of Colleges of Physicians. We also have Mercedes with us, Commercial Director for Respiratory and CEP and GSK in Spain. And Mercedes has a degree in pharmacy with over 20 years of experience in the pharmaceutical industry. And Victor, you already know him. We know that he is a great moderator. He's a sociologist, a co-founder and director of the Foundation for Ecology and Development, Ecoles. So this said, you all have many projects, many ongoing projects, and I would like James to start by explaining to us how do you implement the decarbonization process, your commitment? How have you implemented your decarbonization commitment and process?
So I'd like to introduce myself first. Thank you for the intro. So my name is James. I head up the sustainability team at Newcastle Hospitals. And the reason I'm here is because we took a brave decision as a group of hospitals to declare publicly that it is a climate emergency, that is a health emergency. So our board and our CEO were really brave in framing that. This was in 2019, just before the pandemic we've heard about. And we made that commitment, and I shared my concerns about the planet and the impact it was having on health. And I just wanted the board to feel that pain as well and know that it was a priority. And thankfully for me and my own sanity, they agreed. I must have said something right. And they started that journey with me. And about the same time was where Nick's story with the NHS started as well. So we've kind of been working together at a national and systems and local level in that regard. We made that commitment without knowing what we were going to do. We didn't have a plan. We didn't know the steps that we needed to take. We just knew where we wanted to be at the journey and how quick it needed to be. So we've set slightly more ambitious targets for net zero, but we can debate about when that needs to happen. It's more about the rate of reduction for that action. And we made a strategy after we declared. We have an action plan with that strategy, and we are trying to deliver that. Finances are a challenge, like they are in public systems. But there is money becoming available. Nick touched on that, for decarbonisation in the UK, and that's what we're really gearing up for. In terms of projects, we've had great success in waste management before the pandemic, in moving waste up the waste hierarchy, so no longer, make and dispose of. So that's been really good. More reusable elements like sharps boxes. We've used a long time reusable sharps boxes. Instruments, that kind of thing. And also we've had good success, Nick touched on it there, where we've got medical gases and other care pathways that are very harmful to the environment. We've been able to trial innovations that have directly reduced that impact. But the challenge still remains. The UK is very heavily reliant on fossil fuel for its heating. So weaning ourselves off fossil fuel gas and either electrifying heat or green hydrogen, which I've been hearing about today, which sounds amazing, is one of our biggest challenges. We've got a very old estate. Hospitals in the UK are in need of investment at different stages, and that's a real challenge. So when you're talking about timeframes of 2 to 5 years, A lot of us are locked into contracts, and investing in infrastructure is hard. But we have made commitments of new builds, just like Nick's touched on there, making sure we don't lock carbon into those developments. So we've got some good success there. They're not in the ground yet, but we are building those buildings with no impact from fossil fuels. So there will be electrification of heat with air source heat pumps, and we'll have solar panels, and there will be the best we can make them in energy efficiency terms. So I think I'll leave it there, because I could talk all day about this as my specialist subject. But I'm looking forward to the discussion and bringing some other examples in. Thank you.
Gracias, James.
Thank you, James. I understand that the investment and research are two key factors, right, in all these process. Well, you can, we'll ask you some questions about this later, but Conrado, will I have a presentation? May I? Okay. Well, first of all, thank you very much to the embassy for inviting us to tell you about a project that we're working on. Thank you, Nick, and thank you, James, because we shared a few things before, and because of that, we all learned from each other. Well, the first thing I have to say is that it was the National Health Services who, or what inspired us to work within the Canary health care system in these issues that were a little bit away from the core of the organization, and you inspired us. And this was a project that was born within the COVID pandemic, with all our professionals focusing on the pandemic. But there are also a set of circumstances that made all this be part of the agenda of our local healthcare system. And this is that Canary Islands in 2019 declared the climate emergency state, and it started to work on an energy emergency law, and it looked into how the climate change could affect the inequality in healthcare systems, and how all these can be generating towards the future problems that have to do with a public and universal healthcare system like the one we have in Spain. There are four main goals. First of all, net zero emissions, clean energies. Well, at the end, I'll talk a little bit about what we discussed before. I think it could be a bit different in Canary Islands. And this is also happening in the healthcare system, because this is the one that's going to be most impacted in the future from climate change, all the problems related to climate change. And as an example, when we presented this project to the Ministry of Ecological Transition, they were quite surprised that in the middle of the pandemic we were thinking about these things. And leading from within, the idea of leading from within the Canary healthcare system towards the national system, right? And this generated, but we realized that this was generating employment and many other activities, and this is important. This was allowed to incorporate into the healthcare system, which is sometimes very rigid, sometimes very flexible. We could incorporate other profiles different from what we normally see in the healthcare system. Here I can share with you some of the visions of this project. I think it's been discussed already as a factor that is quite differential. And this is the use of our professionals as agents of change. I think there are very few professionals as recognized and listened to. You know, you don't even listen to your boss as much as you listen to your doctor, really. And I think the action that they undertake, and being now on top of everything, you know, because ultimately all this is about coincidences. This medical organization has this project that is actually led from the Canary Islands, and we are part of this. And I think because of all this, we are in a very good position. Pilar also explained how the ministry itself is developing and drafting a plan. Another concept is One Health. Is about seeing everything with a most important vision, everything that's got to do with a circular economy. Imagine what this is like in the Canary Islands. 8 islands, fragmented territories, all the waste that is generated. Where does it go? How can we handle this? And also a great opportunity for us, health on all policies. I don't think anybody was paying more attention to the advice of the government of the Canary Islands than during the pandemic, because you always had to say what was the level, what was the traffic light, what were the restrictions. We have met all the sectors, the social sector, financial sectors and everything, and that is a connection that we mustn't lose in order to act on all the policies that have to do with the government, public procurement, establishing certain conditions. It's not about the company to take part, to have a certain ISO, but if it provides food, it has to use electric vehicles. For example, this is just a very basic example and very paradigm type. Everything that has got to do with renewable energies in the Canaries, the use of wind energy and solar panels is absolutely crucial. We now also have an opportunity with all the European funds that that will receive and apply. We can talk, like you said before, about sustainable buildings. We have to think about sustainable buildings. And we're working with other administrations, and we are using R&D and investment in a project to use hydrogen within the healthcare public system through R&D projects that are funded with European funds, with the Canary Islands Institute of Research, where we will end up being part of the creation of the energy. And like Nick said, this is going to be by 2024. That's very immediate in time. So some examples in the Canary Islands is surrounded by water. It has a problem. It doesn't have water. It has to work a lot on the desalination of the seawater in order to provide clean water to the population. The savings of water, 1,000 liter waters, represent almost 43,000 tons of CO2 per year, 31 tons of CO2 per year. And this could be used to provide energy to the healthcare system as a service provider, but also as an advisor on different actions or projects. Projects as clear as the electronic prescription generated. It stopped up to 10,000 trees from being cut. So there are a lot of actions that we can take. It's not just digitalization and implementation. We have to get the right perspective, and that is what we are working on in a horizontal manner within the organization. And something that Carlos may be very familiar with, which is the HFCs. With the change of what we use every year, we consume 1 million in the Canary Islands at zero cost because it's regulated price. If we used other less contaminated ones, you will see here the number of flights from Gran Canaria to Tenerife that we would avoid, or from Gran Canaria to Madrid that we would avoid. And just to tell you some of the things that we're working on, this is what I wanted to do, and I hope this helps drive the Canary healthcare system, because in our territory we can help a lot, Pilar. And we can tell you how to tackle that sand haze. If you got it in Madrid once a year, imagine how many times we get it a year in the Canaries. So we know a lot about it. So thank you very much. That's all from me. Okay, we pay attention to what you say. I also come from an island, so we are in the similar situation. Now we think Carlos will get connected. Well, Carlos Cabrera and his dad, Pedro Cabrera, is the president of the College of Physicians in the Canaries. They are the promoters of the climate change tackle and the Alliance Against Climate Change. And as you say, I'm going to start by saying that the physicians must be aware of the fact that with our medical council, we can get a lot out of with regards to the education of the public and raising awareness amongst the patients. Carlos, you have the floor. Good afternoon, and thank you, everyone. Can you hear me well? Maybe I can put the volume high. I talk quite loudly, but okay, great. Well, first of all, thank you very much to the organization, the British Embassy, of course. And also, I'd like to thank JSK for their involvement in all of this. And I'd like to say, to start with, that I'm a little bit jealous of the NHS because they are quite ahead of us in the project. And I like to say that they are a real source of inspiration for what we are doing. Well, what we have tried to do is we have to raise awareness, and we had to start turning the wheel for the knowledge and to take action to tackle climate change from the medical sector. Before, you talked about a survey within the NHS to see what professionals return. Well, that is one of the actions that we want to implement, because from our point of view in Spain, the physicians have a general knowledge of the climate change that is very similar to that of the general population. And it's not very clear to us whether they already simulated that this climate emergency goes along with drastic health changes. One of the things that we want physicians to understand is that fighting for sustainability is the same as preventive medicine. We have worked a lot with the help and the key promoter of all this, which is the General Council of Official Colleges of Physicians. We created this Medical Alliance Against Climate Change, which on the one hand has the council, the medical council, and at the same time it has the scientific associations. The idea is to include or to address medicine from an ethical perspective and from a scientific perspective in order to address all the physicians so that they understand the problem and so that they act accordingly. You talked about influencers before, and I think Victor was very right when he mentioned it. We doctors, we physicians can work at different levels. We can work on our place of work. There are a lot of things we can implement or improve, for example, recycling, the energy management, that can be improved. There are loads of examples of what we could do if we know how to do it and if we are insisted on it and if we have the opportunity to do it. We can also do it from our own professional practice. We've talked about the medical council. We think that is crucial. Conrado said before that doctors are better listened than bosses. I don't know whether I'm listened, but I know that our profession is people pay a lot of attention, and I think we have about 1 million medical consultations in Spain. So the capillarity towards the society from the physicians is very high. In the same way that we say, well, stop smoking or eat more veg, we now have to say, well, look, we're going to have to start having more sustainable practices, because sustainability is absolutely related to your health as a patient, but also to the loss of health within the population. Obviously, you've talked about the example of inhalers, but we can also talk about the vinters. I mean, we can implement treatments every 8 hours, every 24 hours, and that needs a blister. Sometimes you need a blister every 8 hours, but if you have a 24-hour treatment, then you're going to need only 2 blisters. So we can reduce waste there. Obviously, the inhalers are the most obvious ones, because at zero cost you have a benefit in footprint that is very big, and because really the patients are not going to be harmed by these changes from MDI to dry powder. So this is a paradigmatic example that is very widely used, because we feel very comfortable. I'm a pneumologist and I see COPDs and serious cases. So these are things that we can do where we work, or our place of work, but we can do other things. Physicians that are motivated with climate change, there are many of us, we can raise awareness within the medical sector. So the medical community has to be aware of all this, and once that change is implemented, where all physicians can see that sustainability equals health, we'll be able to act as a lever towards the society. People may see the COP summit on TV, but at the same time, physicians can do national campaigns saying that acting against climate change is acting against diseases. And that is something that we're going to try and do from the Medical Alliance. Another reason of being of the Medical Alliance is that initially it was to be leading and drive those who can actually take action. I'm talking about the politicians, but I'm not sure we've arrived and we've we've been very welcomed. We don't need to be leading anything. We just have to be collaborators. We want to help, and we want to position ourselves and offer ourselves as drivers of change. For example, the colleges of physicians through the ministry, and starting with the one in Las Palmas, we I calculate, I know, I reduce. This is a slogan from the ministry, and this has been spread throughout all the colleges. And we want to set an example as to how sustainability and medicine and sustainability and health have to work cross-sectionally, and they have to reach the end. And that is why the Medical Alliance, I think, could be a lever that we can use, and it has the capacity to raise awareness amongst the population. I don't really want to dwell very much into it. Perhaps in the Q&A session we can talk a bit more. Thank you very much. Thank you very much, Carlos. Well, since I am an anesthetist, I think about the anesthesia gases, right? We'll think about what we handle, right? So, Mercedes, what does sustainability mean for GSK? Well, sustainability is absolutely key in GSK strategy. We understand that it doesn't make sense to research and work to improve the quality of life of individuals if we don't take care of the planet where they live. We, as a biopharmaceutical company, have as a mission to develop science. We need to innovate in order to improve the health of individuals. We have to be ahead of the diseases, and we have to anticipate the diseases. And all the companies that work in pharmaceutical innovation have R&D as the key axis. But what makes us different is not just what we do, but how we do it. The way GSK develops its activity positively impacting on the environment is what we call responsible innovation, or behind the science. And that positive impact means that we have to take on certain commitments. And in order to do so, we first have to understand our responsibility within this sector, which is the health sector. And if this was a country, it would rank fifth as a gas emitter in the world. So we need to contribute to mitigating the global warming through caused by greenhouse gas emissions and CO2. And because of all that, GSK already more than 10 years ago set out very ambitious targets for 2030. First of all, we want to reach a net zero impact on climate by 2030, and this goes through the three scopes: net zero emissions in our operations by 2030, 100% renewable electricity by 2025 already, and we've already met this target in Spain, and net zero emissions throughout all our value chain also by 2030. And we don't just want to reach that net zero impact on climate, but we also want to have a positive impact on nature through the reduction of our environmental impact, but also through investing on restoration programs in order to offset that impact that we cannot avoid. At the end of the day, we want to return to nature more than what we obtained from it. And the truth is that we are getting very positive outcomes. These commitments are not just commitments, they are actions. And since 2010, GSK has managed to reduce by more than 34% our CO2 emissions, by 78% the wastes in dumps, and by 31% the total use of water. So the truth is that we're really proud of ourselves, because I think GSK is very well positioned. That is why we can add value to these type of forums. And at a global level, GSK is considered the most sustainable pharmaceutical company in the planet by the Dow Jones Sustainability Index. Therefore, I think we are on the right path, and we're really proud of it. Well, thank you very much, Mercedes. But on top of that, I'm going to add that you are very involved in training and dissemination of information. I think that is fundamental, absolutely crucial for the message to reach the public and the professionals. I think that is important to be borne in mind too. Thank you very much for everything. Well, Victor, you moderated very well before. I don't even know how to ask you something now. So when are we going to have the calculator of the footprint? Well, maybe ask you that a little bit later. But what I want to know now is how are you going to address the work on health and environment? From what perspectives do you use? Well, the first thing we need to do, I think we need to recognize humbly is that the two sectors, health and environment, we have been divorced, very stupidly divorced and very honestly divorced. Because we should have the best relationships, but we are discovering this recently. So we, after the Paris summit in 2015, we promoted and created or promoted the creation of a group which was a Community for Climate. This is a platform to implement in Spain with ambition the Paris Agreement, where we had the public sector, the MITER, the Ministry of Ecological Transition, the Spanish Office for Climate Change, and the Spanish Federation of Municipalities. We also have the private sector, the Spanish Network of Global Compact and Green Growth, and then the third sector, the Red Cross, CO BirdLife, and ourselves, Ecoles, which are more or less the secretariat of the initiative. And progressively, we've seen the creation of sectorial communities, so to speak. And the COP25 in Madrid is where we created Health for Climate, Sanidad por el Clima, which is the multi-factor platform. It's a private-public platform for the healthcare system or healthcare ecosystem to address what I said before, mitigation, adaptation, and we could even say a massive seduction of souls towards a sustainable life. And I'm sure there is no other group in the country that could do better than you. There isn't any other. No, not the media or journalists or politicians, NGOs. No, not at all. You have that power because you also interact with the population at a time when, at a time of weakness and fragility, when that individual is more open than ever to listen about how to get out of that situation. So you have an enormous potential, but you are an army that has been a little bit latent. It's been a bit asleep to date, but you need to wake up, because otherwise we cannot reach sustainability. Pilar mentioned it before, Aparicio mentioned it before. You will not be able to do it as fast as possible if we don't go ahead with that massive seduction of souls. So these are the three goals of Sanidad por el Clima, or Health for Climate, with three key goals as well. One, everybody. When I say everybody, I say La Paz Hospital, which is just around the corner, and the chemist in a little neighborhood, in a little village in Extremadura with 600 inhabitants, and the largest pharmaceutical multinational, and the small center of specialities. Everyone, the whole healthcare system has to take action. I think that is absolutely fundamental. I'm not sure whether I'll get the translation right. We don't need to have anybody taking advantage of climate. Somebody who is a bit cheeky, and somebody who doesn't take on his own responsibility. And then it's the co-responsibility. I live in Aragon, in Zaragoza. And in the rural municipalities over there, we used to say, I'm sure you say something similar in Canaries or in Galicia. I was talking to some colleagues before. They say the street would be clean if everybody swept its own bit. And this is what it's all about. GSK has a very long piece in the street, so they have to deal with that. And other smaller actors have a smaller piece of the street or pavement that they need to sweep. And then thirdly, we have to be a community of makers or doers. And we need to have a diagnosis, and that is good. But we also have to change things. The ambassador said plans are good, but what changes the world are not our intentions or our plans. Our actions change the world. So we need to go down to action. That's why Health for Climate is a community of doers. Doers is how they say, yes? And there are three key criteria. First of all, we want, and this is actually happening already, the pioneers are getting together. And why is that? Because social change works out of mimicking. And if by 2025 you say that you're going to be, you already said it, you're going to be a company that is only going to use green electricity, well, Conrado talked about jealous or copying. Well, they may say, well, if they do it, I'll do it too. So social change works by mimicking. So we want to group the pioneers, we want to get them together, people that are ahead of everyone. You're doing it in the Canaries, they're doing it in Galicia, in other places. So people who are ahead of the others take on more risks, but they set out the path. And so we want this to be a community of pioneers. We also want to facilitate tools for action. Manuela, you were asking me. So on April the 7th, we're going to present a specific tool for the footprint of the healthcare system, what happens with the consumption in ambulances and anesthesias, etc. That's very desired. And we also want it to be some kind of platform to add visibility to the actions of those who are already taking action. So in that sense, what we mainly want is we want to practice addition and multiplication. In the school, and I'm sure in the UK as well, we learned 4 rules. We learned how to add, how to deduct, how to multiply, and how to divide. Lately, there is a sort of predisposition to deducting and dividing, but this community, and at this time of the humanity history, demands from us to concentrate on adding wills for action. And I think it's also very important that, and I'm sure there will be research studies to prove it. That's my thesis. And Virgilio was saying, those who can are those who believe that they can. And very surely many patients will get better because they believe they can get better. And the opposite, they will not get better if they don't believe that they will get better. So in that sense, I think we also, from Health for Climate and the alliances and the College of Physicians, I think everybody here, we have to generate hope for change. Change is possible. Is it difficult? Yes, it is. Is it unlikely? Yes. But physicians are very used to fighting against improbable cases, right? There are people that you give them a life expectancy of 10%, 15%, and yet you continue working on healing those patients. You continue fighting for that unlikely healing and cure. So this fight is improbable, is true. But at the same time, we also have to work for the unlikely cases. And if we do it with determination and will, I think we can be successful. So also a goal of this community of Health for Climate consists on generating hope for climate change.
I don't know if we have time for questions. Can we make room for a couple? Excellent. James, I was very interested in hearing. I was very interested in what you said, that health professionals are well aware and involved in the climate change. I'm under the subjective impression that we're not as aware or committed here in Spain, and we still have a lot to learn. So what would you recommend to Spanish professionals in this sense?
Well, I'm not a clinician, so I have to qualify what I'm going to say. So I'm an environmentalist. That's my background. So I've been trying to communicate the importance of looking after the planet for a very long time. I think it's multifaceted, I have to say. I've been in the health system since 2010, and it was only really 2018-19 when society started to accept that climate change was real. That's certainly my understanding, particularly in the UK. So there was examples of Extinction Rebellion, Greta Thunberg, David Attenborough with the BBC actually talking about the human impact. And I was no longer wasting time and energy on debating climate science and its impact on health. And that was fantastic because I wasn't putting my energy in those spaces. So I think that was a pivotal moment. There's been plenty IPCC, intergovernmental panels on climate change reports over many years saying that this should be important. So it feels more like it's a societal change and understanding, and we've heard from everyone here. And then colleagues elsewhere in Royal Colleges, we were just talking in a session earlier today, in the UK, almost all, if not all, Royal Colleges have declared that this is a priority for them, working on their specialities and their education and their training to focus on it, and even taking that extra step to divest from fossil fuel investments in their financial holdings and pensions. So that's only happened in the last few years. I would say they are all replicable actions in other health systems. So I think this could be a pivotal moment for bilateral agreements and working together. And it's certainly not the UK doing everything first from the conversations I've had today. Conrado with the green hydrogen project in the Canary Islands sounds fantastic. It's just a pipe dream that we've thought about in the Northeast. So really, really good to hear that.
Can I don't know if this one works. Can I just add one very abusando brutalmente.
Tremendously abusing my position here.
I don't know whether my colleagues from the UK would agree, but I think the fact that there is a political consensus on this makes it all much easier, because people don't feel that in order to maintain or preserve an element of their political and thus personal identity, they need to struggle. It's fine, And that's been super important in allowing the sort of change that you've described, because that political consensus has only really evolved in the last decade. Absolutely. And it's been gradual.
Sí, yo quería comentar a James que aquí también.
Yes, I wanted to tell James that here in Spain, in a professional union, an entity that regulates all associations of professionals, we are working on, well, not necessarily on the medical code of ethics, but we're working on the general ethics code of professional associations, and we're promoting sustainable use as a principle and in connection with the OCDs. And we're trying to include that into the very code of ethics of all associations. So, Conrad, I have a question for you. What difficulties have you faced when... I'm assuming one of those difficulties must be refurbishing old hospitals, because I'm thinking about island territories like the Balearics with hospitals that may be 50 years old, maybe older. It doesn't look easy. Well, as we just heard, it looks like there's consensus now for one reason or the other. And that is an opportunity that we need to seize. Like the example of your alliance, you took a step forward without anyone asking you to do so. And that's a way to carry the debate forward. Perhaps the difficulties we've faced, particularly in a territory like ours, considering infrastructures, there are things that are better left untouched. You try to fix something and something else crumbles down. But yes, infrastructures are difficult, but more difficult than infrastructures, I believe that the greatest difficulty is awareness. Well, of course, islands are highly divided territories, and their local government and administrations, jurisdictions, and perhaps we should work on that too. Perhaps we could work on joint regulation affecting not only the health system but also other systems. And perhaps the greatest difficulty doesn't lie in awareness. It lies on understanding that some things need to be changed. Plenty of projects on renewable energies are coming up with huge hurdles for reasons other than ecology. So we're now launching a research project to generate or to draw hydrogen from the ocean. We have to innovate. There is no choice. And, well, all the permits and everything else that is required will follow suit. But you just have to innovate and grab anything that is already out there to keep moving forward. Well, what about you, Carlos? What are those hurdles along the way? I'm sure we will come up with plenty of difficulties ahead. But I've always been an optimist, and I believe that hurdles are out there for us to overcome. And one of those difficulties is that my perception is much like yours, that climate change is one of the lowest or least pressing concerns among professionals, health professionals. And perhaps the high consensus on climate change in the UK is not necessarily so present in Spanish politics. And some people are still thinking that climate change is a political tool. And I do see that the Medical Alliance can actually lend a hand in that sense, because we can reach out to all of our professionals and help them understand that climate change affects not only the health of the planet, but also the health of our patients and ourselves. So we need to talk to doctors about climate change and tell them that it can affect them personally. And we need to make them realize that it's not a political issue, because professionals do listen to us. So if there are difficulties out there, we will find solutions that are bigger than our difficulties. Perhaps my concern lies on economic difficulties coming from policies. Well, obviously, it's not my place to do something about that. The Alliance is here to try to help, but maybe those would be the most difficult things to tackle. I mean, I can only wish that we can get hold of European funds to carry these actions forward, rather than depending on this hydrogen research project, and wish we could do that as something different than a research project. Maybe that's where the big difficulties lie. The ones we can address will be addressed, I guarantee. It's great to hear your optimistic view, Carlos. Mercedes. I know that you're doing plenty. I do. But what actions have you launched that have already had an impact? Well, in GSK, we aim to be a role model for the entire industry. It's not just enough for one company to change. We need joint efforts, and that's why we want to set an example and become a role model with the national and regional health systems, with health professionals, with patients, with the entire ecosystem, if you will. And for that purpose, we want to launch political and individual actions that will bring us from sustainable awareness into true sustainable action with real impact along this path into a carbon neutral, healthy society. And yes, we want to set an example globally and in Spain. We bear a huge responsibility. GSK is one of the market leaders in respiratory devices, and 1 out of 3 respirators and inhalers in the Spanish market come from us. So a long time ago, we decided to develop a program to reduce the emissions from our inhalers from 2 different perspectives. First, we launched a product portfolio in 2013 with the targets of enhancing a patient's life quality for asthma patients and COPD patients. These inhalers contain no greenhouse effect gases. And the second one, for patients that still need rescue inhalers, we have a project under study to use a lower carbon footprint gas. But second, and even more important than that, we are working for the transition into non-polluting inhalers by clinicians and patients alike. Obviously, as whenever patients find them useful. And it's not just a target for GSK. Most pharmaceutical companies are already marketing inhalers without HFCs, and most patients can use those. And we've had good results in that sense. As of 2018, we have reduced the consumption of 1 million polluting inhalers and have agreed approximately 0.4 treatments for chronic patients with sustainable inhalers, which actually leads to true savings. More than 28,000 equivalent CO2 tons. And if we translate this into cars, we're talking over 60,000 working cars out there. So, not bad, I would say. At a global level, we also participated in COP26 as a partner to the British government to act as a catalyst for the decarbonization of pharma industries and also to cooperate with the decarbonization of health systems. In Spain, we launched the first debate on climate change and health. We call them Green Talks. We work with Ecotech, Ecoles, with the Ministry of Health and several other ministries. And our vision remains being, like I said, a role model in this endeavor that we launched so many years ago. Well, thank you. I believe the chairwoman of CELSIT is here because I said hello to her a while ago. In that sense, I believe family doctors have a lot to say on the subject as well. So it is very important for the Medical Alliance to be present in scientific associations, particularly in primary assistance associations, because those are the clinicians that spend most time with patients. And they're the ones who have this precious interaction. I was going to say precious time, but they don't have a lot of time to interact with patients under the present system. But they have this precious opportunity to educate patients or the population at large in the use of, for instance, these non-pollutant inhalers. Yes, thank you, Manuela, for speaking about us, because we were talking about the Alliance, and we're very proud that you called us to participate. Pedro Carrera is our touch point. Well, actually, he came in touch with us because for 8 years now, he has been leading a group on planet health, or Healthy Planet, and he's part of WONCA, the World Organization of Family Doctors. We work with WONCA Europe, and 3 or 4 years ago, this new initiative was launched to raise awareness amongst doctors, and I believe, Carlos, that we've gone a long way. I'm not saying we don't have a long way to go still. That's why we're working with the Alliance. But actually, we have 22,000 partners or members who have always taken positive steps ahead in sustainability and in making and having a greater impact on sustainability and health. Last week, for instance, we had a prevention seminar where we discussed diet recommendations and how our recommendations can actually uh, improve our patients' lives, our planet's health, and everyone's health. So I would like to thank GSK and the British Embassy and the Royal College for inviting us to participate in this endeavor. We're delighted to be a part of it. Well, thank you. Actually, you were certainly the first to take a step ahead as a scientific association. You and anesthesiologists, I will not leave them out. I will not forget. So, Victor, I'm afraid we have to wrap this up. We're already overrunning, but just one final question. What initiatives were brought forward in the COP on health and climate change? Well, I would really have to summarize that. There are two different scenarios in every COP. One for two stages, so to speak. We have the government stage where consensus and unanimity rule. So it's very difficult to get Saudi Arabia, Russia, and the others to agree. But then there is a different stage on which consensus and unanimity do not necessarily rule. I'm talking about the volunteer agreement stage, basically among pioneers that want to do more, the more ambitious groups that meet other more ambitious partners. One of those bilateral agreements, well, if you're interested, I can send you our report on all those agreements and those who signed to them in many different fields: finance, mobility, health. And under health, an agreement was signed, proposed by the British government, the WHO, and associations against climate change to shift world health systems towards climate action. And I believe 50 different countries undersigned the agreement, and 14 of them announced specific climate change actions with deadlines. The UK stated that they would be carbon neutral by 2040. Belgium and Spain, 2050. Dear Pilar, we need to change this. We cannot let them win the race. We're racing towards net zero. And we will overtake other players and other competitors. For instance, African countries committed to 2030 or 2035. That's why I insist that the host country to COP25 and to COP26 should make an effort together so that this alliance that stemmed from COP26 to grow not only in numbers, but also, as you both said, in new initiatives and deadlines. What do we need to do in 2022 and 2023? Because Latin countries are very good at certain things, but we also have our own flaws. Particularly, we tend to procrastinate quite a bit. So we leave everything until the very last minute. So we're very good at long-term commitments, but we keep thinking, I'll think about it tomorrow. So Latin countries should actually jump into action and establish deadlines and consider what we're going to do this year, next year, and the year after that, because it is action that changes the world. So we need to nourish that commitment that came from Glasgow. Obviously, other European countries can jump on the bandwagon, but We need to reach Egypt with an initiative to move even further along this path. Well, I believe that's a very positive message to wrap up this meeting. Actually, we took up more time than we were given, but everything has been so interesting and we have learned so much from all these interactions. So I will leave you with this message that as doctors, we are stubborn. We are stubborn and we believe in that impossible cure and that improbable solution. Thank you very much.